Welcome to Talmudic Treasures. Today we're learning Yevamot, page 12. And on this page we find that although we have a special mitzvah of having children and raising children, there are actually a few times that women are allowed to take certain precautions and use what's called a moch, a special cloth, in order to prevent them from getting pregnant. And the times that are mentioned are if a woman is of a young age. And because of her young age, there is the possibility of her getting pregnant. And because of the dangers of pregnancy at a younger age, we're concerned that she could actually die during pregnancy. And therefore, we would actually allow her to wait until she's a little bit older before she starts having children. Second of all, we find when it comes to a woman who is pregnant, that we do not want her, even though typically a person who's pregnant is not going to get pregnant, but nonetheless, we also allow her to be able to use this form of contraception to be able to prevent her, again, from what normally would become a potential pregnancy. And also a woman who is nursing. Because when a woman is nursing, so much of her energy and her nutrients are being given over to the child, we're potentially concerned if she gets pregnant right away, she may end up ending her nursing of her child prematurely. She'll end up weaning this child before his or her time. And because of that, this child may not get the proper nutrients. And God forbid, there's a chance that this child may die. And therefore, we do have these leniencies that we will allow this woman to be able to use this moch to, again, prevent pregnancies from occurring. Now, of course, this does not mean that we could just automatically assume from a piece of Talmud that this rule in general would apply in our lives. There are many different discussions when such precautions can be taken, and it's necessary to speak to a rabbi, someone who is knowledgeable about the situation. But we do see from here, again, a very important concept, and that is the preservation of this woman's life and making sure that her life is safe, and we do not want her to be potentially for her to die, and we want everyone to be fine.